Hello, hello, hello. Hi, guys, and welcome to another episode of Bent Pages and Bending Bodies. I'm your hostess, Dr. Hannah P. And before we jump into today's episode, you already know what to do. Go ahead and like, subscribe, follow to this page on Instagram, TikTok, YouTube. It's at BPBB Podcast, like Bent Pages, Bending Bodies Podcast. Yep. BPBB Podcast. This episode is available on YouTube for the video, and then the audio is available on Apple Podcasts and Spotify. Yeah. All right, guys, I have another great episode ahead for you. I have a guest, a very special guest that I went to school with. Her name is Dr. Kennedi, PT, DPT. Yes, our first doctor besides myself on this platform. I'm so excited to have her. Just a little bit about Kennedi. She is from the Midwest, but she's currently practicing in Southwest Ohio. Shout out to Ohio. That is my home state. Go Buckeyes. And a fun fact, she has been dominating in pickleball. So welcome, Kennedi. How are you?
Hello, thank you. I'm so happy to be on here. I'm so
Thank
excited.
you for being here. I definitely appreciate it. Perfect. How's your night going, first of all, before we
It's
jump into things?
good. It's good. It's like raining heavily out there, but it's good. It just started.
I know, I just looked out my window. It's just it was like trickling, but yeah, we're having some rain here too. All right. So, Kennedy, you are a pediatric therapist. This is the first pediatric therapist that we've had on this platform. Kind of tell us what that means, what kind of population that you work with, and what ages.
Sure. So I'm pediatric PT. I'm working with ages like two, well, not two, that's exaggerated, like 4 weeks to 22 years old. Um, yeah, 4 weeks to 22 years old. The diagnoses that I see range. We have cerebral palsy, which is just when either one side or whole parts of your bodies are affected. Um, I have torticollis babies where their muscles get tight and they can't like move their head. Their head is stuck in one position. I have autism, a lot of autistic kiddos that I see, toe walkers, just see a wide range, wide variety. Yeah.
Oh. So, what drew you to pediatric therapy? Because I'll be honest, I never had that drive, that inclination to go that route. But what drew you to it?
I think ever since I was in high school, actually, I've just loved working with kids. Like when we were younger, we would volunteer at VBS, like Vacation Bible School at church, and um, I would babysit my little brothers and my little cousins all the time. And I had PT done when I was a kid. I remember going to an ATI for adults, super boring. I mean, I was in seventh grade. I
Yeah.
didn't really enjoy it too much. And then I had PT done in high school, and it wasn't at a pediatric clinic, but the clinician I had, she was so great. She made it fun for me. And she was just saying, she was asking me what I wanted to do. And I said, I just want to be in the medical field. I want to work with kids. And she said, why don't you do pediatric PT? And I said, you know what? Why do I not do that? I did observation hours and then yeah, I realized that that's what I wanted to do in high school. So that's how I became.
Who you are, the
I
wonderful.
was like, that's how I became who I am.
Yes. I love it. I love it. Um, and you also so in our schooling together, we went to PT school, right? You had a pediatric rotation, right?
I had two.
Oh,
Um,
cool.
yeah, it was my last two, my longest two, 10 weeks and then 12 weeks. They were both amazing. My last one is actually where I have a job now. They offered me a job, and I said yes. And that definitely helped prepare me and it helped me solidify that I wanted to be a pediatric PT. Yeah. It was definitely a huge help to do a clinical rotation there.
What type of settings can you find a pediatric therapist in, and what setting do you work in?
Yeah. So definitely outpatient. Um, you can find outpatient clinics, like just Google them, search pediatric outpatient clinic, and you'll find them. Hospital inpatient, they definitely have them at like pediatric hospitals, and then the schools, so you'll find pediatric PTs in the schools. Um, and yeah, that's about where you would mainly typically find them. I work in an outpatient setting. Uh, yeah, an outpatient setting. And I so lucky because I get to work with OTs and speech therapists. And it's so nice because I get to do co-treats. We do bump treats, which is if I see a patient for an hour and then right after me, they'll have their OT or speech session. And I love it because I get to collaborate with them, see what they're working on, and then sometimes we get to like intermingle what we work on.
Yeah.
So, yeah.
Talk to us about that. What is it like, that interdisciplinary collaboration going on?
It's just really great because some kids are they are very hard to work with one-on-one. Like if it's just me trying to do PT with them, I need a second set of hands. And so a lot of the times I'll be with a speech therapist and with them they'll work on like play skills, which that's something I learned. I didn't realize that speech therapists would work on play skills with kids, but they'll work with play skills and I'll do positioning, facilitating certain movements, and that helps a ton because the kids are distracted and I'm able to just do what I need to do to help them get stronger, get to where they need to be. So
Mm.
I absolutely love it. And we'll talk outside, talk about game plans, like how we're gonna hit what we're gonna do that for that session or the next sessions or where we want to progress them to.
So with this, do the disciplines typically try to coordinate the plan of care to be the same length for each one? So if PT chooses, I don't know, what a typical, we'll talk about typical plan of care is.
Mhm.
But if PT says, 12 weeks, for example, is that something that OT and speech are also thinking as well? Or does each discipline kind of make their own plan of care for how long they're going to see this patient?
Mhm. Most times I would say our plan of care timeline up. And we don't even plan it that way because sometimes we really don't know if they're appropriate for a co-treat. So but most times it always lines up because our typical plan of care usually is, like you said, 12 weeks, and then we'll do our progress note um, every 12 weeks to see if we need to move on or if we not, or if we do not need to. And we'll talk about it. The disciplines will discuss it. Like I had a patient the other day and he got all three disciplines, PT, OT, and speech. And for me, I was at a point where I could discharge. So I talked to the speech therapist, OT, and we were all on the same page. So we just decided, you know what, next week we're discharging. Like he's going to be done from all three. So I think it just depends case by case, but most times our plan of cares usually do line up.
Gotcha. At
Mhm.
your facility, are you guys able to do therapy like the whole day for them? So if they have all three disciplines, can they see them in one day, or is it something where they have to like come on different days? I don't know if that's a weird question.
Yeah, no, it's a totally valid question. And we call them bump treats.
Oh,
So we try to get them so that they're all on the same day, or sometimes I have a kiddo who's just not, he's they're not gonna tolerate it if it's like a 1-year-old.
mhm.
I don't want them after they have just done OT for an hour because they are just going to be done. So if they're if they're able to, then we do try to have them back to backs just to save time for the parents and they can just be there for that length of time instead of coming back 3 times a week, which would be crazy. Some people do,
Yeah.
but
Do you
they
see, did you say that you typically see your patients twice a week, or did I mishear?
I have some that I do, but no, but just them coming in more than one
Oh,
time a week for the different disciplines.
how often do you see your patients a week? Now that we're on that.
I see most of mine for one time a week. I
Oh,
have a couple babies and some toddlers that I see twice a week though.
mhm.
For torticollis, it's really important to get those muscles stretched out and just
Yeah,
strengthened. So we suggest 2 times a week for them, especially because they're so little and they grow so fast.
right. And you definitely
Better
don't
to,
like
yeah,
stuff.
exactly. And their head's gonna get all flat. We can't
Yeah.
have, gotta get them in a helmet quick.
Right. Did you say what made you choose outpatient over the other types of settings?
I did not, but I actually did not get to observe inpatient as much as I wanted to, so I don't know a ton about it, but I'm so open to just observing and seeing what it's about. My clinicals were in outpatient
Okay.
pediatrics. And then I did observe the school setting, and I don't think that was for me, just because you do not have a set time with the kids. It's kind of you're just going in there when they're at recess or at PE, and you're kind of just trying to do your thing, but still integrate them in with what they're doing. And it just seemed
Hmm.
like a lot for me to do
Yeah.
as a, as a first time or as a new grad. It just didn't seem like the setting for me at the time.
Yeah. I'm
Yeah,
like, listen, I'm glad that they're like, everybody has their niche, they have their thing that they click with. And I'm so grateful for the people that click with peds and because oh, couldn't be me. I don't know. Like I love kids. Do not get me wrong. I just feel like sometimes I'm not that creative and like to get people to do what you need them to do. These young people who don't know how to follow directions. Let's talk.
right, right.
So how do you get your patients to, first of all, what kind of things I should say do you work on with these kiddos? Um,
Mhm.
a lot of people who have been on this platform, we work with adults, right? And so we know
Right.
working on their balance or we're working on trying to get them stronger back to what they used to be. But these kiddos, they're fresh. So
Yeah.
what kind of things do you work on with them?
Um, so it just depends on the kiddo, but like you said, it's basically like like we work on balance, we work on strengthening. I would say we focus on a lot of functional activities. So um, we have our list, like a gross motor milestones of what they should be doing at certain ages. And whenever I do an eval, I always have that list out and I test them on all those things and I see what they can do. And a lot of the kiddos that I have, um, they are just so weak. Their muscles are not like ours, are low tone. So, do I need to explain low tone?
Sure, go ahead.
Okay, I feel like I don't know. Their mu yeah, their muscles are just not as strong as ours. They're just a little more lax. A great analogy that I've been telling everyone that I heard is that for us, when we get out of a chair, we're just like getting out of a regular chair, but for them, it's like they're trying to get out of a beanbag chair. And they have to work that much harder to try to get up and just do normal things that we do in an instant, but they have to work that much harder. So I have a lot of kiddos like that. And so we just work on strengthening and we just have to make it fun. I look like a fool more than half of the time trying to get these kids to do things. Today I was running around because we have this little cleanup we had these little cleanup toys and he took this mop and he's like waving it around, running around the whole gym. And there I am trying to usher him, like chasing him. And he's fast too, which is good, but we've been working on that. But I worked too hard on that because he's too fast for me. But yeah, more than half the time I just look like a fool trying to get them to do what I want them to do. But the trampoline, shout out the trampolines. It's my favorite thing ever because such an easy way to do strengthening because
Yeah.
some of these kids can't even jump. So just working on that and you're able to facilitate that jump on the trampoline. Um, but yeah, sorry, I
No,
went
I
over.
love it.
But
It's
yeah.
no, keep going, keep going. It's great.
Yeah, we just work on all the same things, just balance, strengthening, a lot of core strength. They're really weak. So trying to just get them to be on their back and roll up in a ball and lift their neck up. Half of them can't even do that. So just working on things like that, positions, half kneeling, tall kneeling, sitting up straight. Yeah. It's
How do you take the things that you want from them and then turn them into a game? That's one of the things that really deterred me away from peds is that I just don't feel like I'm creative enough to make exercise fun. I feel like now in my practice, I can make it a little bit fun for adults, even
right.
though they know what's going on.
Yeah.
For a kid, how do you make it fun? How do you think of your ideas?
I do a lot of obstacle courses. You can do a lot with obstacle courses. You can mix everything and anything in there. And then I'll give them a puzzle with the obstacle course, and they love that. Or it's a lot of give or take. I'm kind of bribing these kids truly. Like I say first we have to do this, then we get to play on the trampoline, or then we get to go play with this toy. And so it's a lot of just coaxing and just bribery, really.
Yeah.
But
That's not too different from adults.
right, no, exactly. It's just what you use to bribe them with, it
Yeah.
changes. But oh, and also I love where I work right now because we're all just kind of out in the gym, like PT, OT, and speech are all out in the gym. So a lot of the times, one of my kiddos will see another kid over there doing something and they'll say, I want to do that. I'm like, oh, we got to do our work first. Then we can go over there. Or some other kid will do the obstacle course who's comes out of nowhere and just does the obstacle course and they're like, I need to do that. And then they'll go and do it. So it's, you know,
I wanted you to do that. Reverse
right.
psychology.
Exactly. I'm like, oh yeah, if you want to do that, you can. And they're like, no. So
That's funny. So how long are your sessions typically?
so my clinic, the way it does in the morning from when you get there, which I get there at 8, um, and then I usually have lunch at 1. So from 8 to 1, my sessions will be an hour long.
Okay.
Um, and then my lunch break is only 30 minutes, whack, but it's fine. Um, so from 1:30 on, and I get off at 6:30, they're 45-minute sessions. So morning 8, 1 hour, and then afternoon are 45-minute sessions.
So what's your schedule like? We talked about this before the recording, but what's your
Yeah.
schedule?
Right. So I do 4:10s Tuesday through Friday. Actually, I'm sorry, that's a lie. I just changed it. So Tuesday I work 8 to 6:30. Wednesday I do 7 to 6:30, and then Thursday I do 8 to 6:30, and then Friday I do 8 to 5:30. So 2 10s, 1 9, and 111.
Yeah. Oh, the 11, girl.
Yeah, I
How's
know.
that?
It's not terrible. My first one is a little baby, a little tort baby, so he's really nice. And then I actually have um a break. I asked for a plan in during that day and
Yeah.
I was able to get it. So I have like a little 45-minute plan break, which is really nice to have on that day. Because
That is
yeah, an
very
hour is not crazy.
11 hours, man.
Yeah.
Yeah. Did it take you a little bit of adjusting to get into that, or did you feel like you were just okay with that schedule?
Well, long story short, I was doing 7 to 5:30 on Fridays. But my 7 a.m. was not getting filled, so I
Mhm.
had to move it to the end of the day, and I didn't want to stay later on a Friday.
Oh,
So I just moved it to, I work at 2 different clinic locations, so I
mhm.
moved it to the other clinic, which is how I ended up 7 to 6:30. So it's not terrible.
Yeah.
But yeah.
So I work 5 days a week, but I remember as a student, I did like 4 10s. I thought it was really nice to have that like that day in the week off, and especially like if it was a Monday or a Friday, like I just like having that long weekend.
Right. No,
So you're
100%.
enjoying that. You say you have Mondays off?
I do. I have Mondays off. I did that on purpose because I like to just like go on little weekend trips, like
Yeah.
go home or just, yeah, go somewhere. So having that Monday is really nice because I don't have to take off any work. I can just go and come back.
Rest up,
Mm-hmm.
back into the work week.
Exactly, exactly.
So is there any particular age group or any particular diagnosis that you just like working with particularly more versus the others?
Yes, absolutely. I mean, I love all my patients equally. I love all kids equally. Um, Definitely the babies are my favorite. Um, like the babies to probably 3-year-olds are my favorite to work with. The babies are, yeah, they can be fussy and they'll cry, but they're so compliant. And
Yeah.
if you just stick a little pacifier in their mouth and they let you really do whatever you want, or just distract them with some flashing lights and they'll be mesmerized by that. Yeah, for real. And you can do whatever you want with them. I like the toddler age, like 2 to 3, because really they're the ones that are running my session. But
Yeah.
if I just throw things in front of them, like throw steps in front of them or hand them something and say, oh, let's come over here, and they'll do it. They don't talk back. Don't give you sass. So yeah, I enjoy working with them a lot. And I also feel as if you can see progress more with them.
Mhm,
And so I like to be able to see my progress.
mhm.
Um, and with them, I think you can see it a little bit quicker. Um, and I feel like it's more apparent as well with them.
Let's talk about parents. So are they involved in your sessions? Do they sit outside? Kind of how does that work?
Hmm. Some of my parents do come in, some of them do not. And sometimes it's a blessing because sometimes I have kids that just act up when their parents are there and
Mhm.
our session is a waste and we don't do anything. We don't get anything accomplished because this kid is just like acting out in front of their parents. And I don't know if these parents are scared to discipline them in front of me, but they don't. And so this kid is just running amok, a menace in the gym. And I feel awkward when I'm being more firm and disciplining them more than their own parents. So
Um,
sometimes I appreciate it when they step out. Um, the babies, I like when the parents are in there because for the babies, it's a lot of education
mhm,
uh, because a lot of it's happening at home. I only see them for in 45 minutes to an hour, maybe 2 times a week, but at home is where it really matters. So I encourage parents to come in, ask questions. I'll perform a maneuver and then I will ask them to perform it in front of me so I can critique them or just show them how to do it at home.
yeah,
So I think it just depends on the kiddo. I have some kids who need their parents back there and they don't even have to be with us, but they'll just be sitting down in a corner of the gym and they're fine and they do amazing. So it just depends on the kid.
mhm,
Um, Having those conversations with parents can be kind of awkward, especially if they like to be in the gym and
mhm,
their child is just not participating well. And so I'll say, hey, what if we try you stepping out 15 minutes at the end or 15 minutes in the beginning of the session just to see if there's a difference in how they act. And when the result is for the better, then I'll have to tell them. I'll have to say, hey, I think you should sit out because we actually got work done today.
yeah.
So it just depends on the child.
Does that happen often or like just kind of intermittently?
I would say intermittent. Well, no, I would say most of my again, I always feel bad whenever I say it depends, but honestly, it depends on the age range. I've noticed that 4 to 10-year-olds work better without their parents in the gym. And which is a big age gap, but that's just what I've noticed is they work so much better without their parents in there. When their parents are there, I
Like
sometimes I
they have like a show or something.
yes, exactly. They're putting on a show, trying to see how much they can get away with. And their parents will step out and I'll say, okay, little Johnny, let's go do this now. And they'll say, okay. Like,
Yeah.
what is this? So it depends on the kid, but definitely like age 4 through 10, I feel like work better with parents.
Quick question before back to parents. When it is just you and the kiddo in the session, how do you deal with somebody who is crying or not wanting to participate or do anything that you want them to do for your session?
Yeah. So, um, not a lot of my kids have some type of like mental delay or just they're not neurotypical. So a lot of the times I we will go on the swing or we will do something that they prefer and I just try to calm them down, try to get them to a place where they're able to even participate in what I want to do. Um, so a lot of sensory regulation, like I said, a lot of swing or just sensory input, even just like giving them squeezes, hugs, getting them in a weighted vest or putting them in a weighted blanket. Um, a lot of my kids, that's what we have to do, which is fine. But then for the neurotypical ones who shouldn't be crying like that or be complaining, then that I just have to be firm. I have to bring out my mom voice, which I hate using, but sometimes I do. Um, but yeah, like today, one of my kids, sorry, I have all these
No, it's
examples.
okay. Go for it.
Um, we have rooms in our clinics. In
Mhm.
our clinic, we have a big gym and then we have little treatment rooms that we can go to. So I will have to threaten some of my kids. I'll say, hey, if we're not listening, we're going to a room. And sometimes that'll whip them back into shape. But then other times we have to actually go into a room. And today we were just in a room and this kid is just screaming in the middle of the floor. And then yeah, so he's just screaming in the middle of the floor. And I'm like, it's okay. We can sit in here for a little bit and then we can go back out there. And but then he started screaming, ow, ow, but I wasn't even near him.
Like,
So,
little boy.
so, so then I had to like open the door a little bit just so they saw me not
Yeah.
in the room with him exactly. Um, but yeah, and he just snapped out of it. Like he was crying probably for 5 minutes, just literally screaming, crying in the middle of the room. And then I asked, "Do you want to jump?" And he got up and said yes. And then we just went and jumped. So it just, yeah, sometimes they really make me want to pull my hair out.
Yeah.
But yeah.
Then I'd be like, oh, you gotta see that on. No.
It's it's my favorite when we have back offices and we have little treatment rooms in the back office and we'll just be typing away and then we'll hear screaming, crashing, and the kid is just like screaming at the top of the lungs and we're just do, 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 do. We're like, oh, by the way, did you hear so and so? And like
Like mayhem
it's just
happening.
background noise. Yeah, a parent came in and he said, I think that's my kid. Should I go back there? And we're like, no, they're used to it. It's okay. They're doing their thing. You're good. So it's just, yeah, it's just background noise at that point. You're crying sometimes.
Listen, you guys have great focus because in my office we talk so much, and so sometimes I like literally, like we literally have to put earbuds on with each other because we're like, if we don't, we will not focus and get typing done. So I can't even
Right.
having like screaming, crying as I'm just like do typing my note right.
Right.
No.
That is so funny. Sometimes I do. I need to lock myself in a room because if not, I will start chatting or I will get distracted by
Yeah.
anything.
I do that sometimes too. Like we have these like little cubicles, like way down these hallways. So I'll just like take my computer, type away down there sometimes just to kind of get away. But
Right. That's where I'll be.
okay, so back to parents. So we talked about, your interaction with them in the sessions. Do you ever have parents who just don't listen to your advice, don't listen to what they should be doing for their kids, and how do you deal with that?
Yes, I do. Back to the toe walkers. I have a lot of toe walkers right now. And for toe walkers, we get orthotics.
Mhm.
Um, and you have to wear your orthotics regularly every day for the majority of the day in order to see a difference or to make a difference. And it just boggles my mind how many parents do not do that
Yeah.
or do not have their child wear them. And then I really have to work on it because they will come to me and say, we haven't really made progress.
Yeah.
I say, well, have you been wearing your orthotics? And they say, no. And I say, have you been doing your home exercise program? And they say, no. Well, again, 45 minutes here once a week is not going to even make a dent in order to get your child's gait back on track.
Yeah.
So I have had to have many conversations like that. And I just feel so awkward every time. But I have to think it's for the kids, it's for their well-being. And ultimately, when it comes to that, it's down to the parents to make them wear the orthotics or put them on them or have them do the home exercise program because a 7-year-old is not going to go home and say, I need to do
I
my
know what they're
exercise. Right. I want to wear these braces. No, they're not.
no.
So yeah, I would say that is very difficult for me personally because I can talk to kids all day long, but when I have to talk to adults, I'm kind of awkward sometimes. And especially having those conversations, like telling these grown adults that are way older than me to, you know, kind of
Get
get
it
their child
there.
on track. Yeah, get it together. Um, Yeah. And I have some parents that are, which is tough when like mom would be on board and then the dad won't be. And then if dad brings, then there's no orthotics. He says
Mhm.
comments such as, I don't know why we're here. Is it necessary? And obviously the kids pick up on that.
Right.
So it's, I'm trying to get parents to buy into it and to have them, yeah, just have them buy into it and just be a part of the process. But sometimes it's tough,
Yeah,
difficult.
I'm sure. Before my next question, let you mention toe walking. For our listeners, what does that mean? Why is it a big deal? And when should we be concerned about it?
Sure. So toe walking is what it sounds like. It's like when kids walk on their tiptoes. Um, it's because your a plantar flexor muscle and the your calves when your calves are get too tight because they've just been in that shortened position for so long, and then um the front your front leg muscles, your anterior muscles are just not strong enough because they've gotten so weak. So you just have no range. Your foot is stuck like you're a ballerina, like that. Um, and I've seen a huge uptick in just referrals, and I've mentioned a lot of my caseload right now are toe walkers, and a lot of them are older, like 10 to 12, which is crazy to me. And when I ask, how long have you guys been walking on your toes? And parents are like, oh, since they were like 3. We got to get them in so
Yeah.
quick. Like, I would say, um, I went to a course actually, and a lot of doctors are like, oh, 2 years old, if they're walking on their toes, it's fine. It's not fine because they shouldn't be walking on their toes. Like that means that there's something going on, whether it be sensory, like they don't like the feel of the floors, or it just feels better up there. We have to stop it because it's just gonna continue to go on. And then the older you get, the harder it is to break, to stretch out those muscles because that muscle is so tight. Um, so yeah, I would say the earlier the better. Um, I've noticed like I have a few younger ones who walk on their toes a little bit, but then when they're in shoes, they walk flat, which is good. So I suggest just keep them in shoes even at home because we don't even want them to try to go up on their tiptoes like that because then it'll lead to the toe walking and then yeah, it just boggles my mind that I have 12-year-olds and they say, "Oh, I didn't really think of it until now." And I don't know, but
Crazy.
maybe it's my PT brain, but whenever I see anyone, a child toe walking, I'm like,
Yeah.
oh, they need to be seen ASAP. What's going on here? Like,
Yeah.
please. So,
One of my nephews actually, he used to walk on his toes, and I like this is like during school. I would be like, guys,
get them
but
in.
right, yeah. So he has since like he's able to walk,
Right,
typically flat
right.
feet. What was interesting about him, we could say like, hey, dude, come down on your flat feet, and he would do that. And so, um, but yeah, I just thought that was interesting. So, what are some, if you see your child, toe walking, what are some things that, parents should think about doing before seeking PT?
Yeah, absolutely. I would say if they getting good, well-fitted shoes, Crocs are not it. Um, high tops are really good because it just if in my high tops, it's not, I don't like going up on my tiptoes. So it kind of stops you because the high tops go up to your ankles. So wearing high tops are really good. Um, Giving like sensory massages, just pressing the bottom of their feet is really good, just to different surfaces as well, just to kind of get them used to putting that heel contact down. So it's not as much of a jarring sensation when they do it while they're walking. Um, and yeah, those would be my recommendations. And just kind of make sure they're not tight. Like just feel out their feet. Like just give them some good little stretches.
Yeah.
Um, yeah, those would be my recommendations.
Do we know why toe walking happens? Like, is it
To be
hereditary? Is it,
honest,
um, okay, I was like, no,
I
but there are people who think they're like, oh, well, my so and so they used to do it, so
yeah,
it's that. But I've
I
heard it so many times.
I wouldn't be surprised if it was genetic at all or hereditary because that would make sense. A lot of times it's sensory. They just don't enjoy that feeling. So then it's a lot of that sense, like giving that sensory input so they get used to it. Or just idiopathic, just unknown. It
Yeah.
just happens. And I see a lot of those. It's just they don't know why. It just really just happens. A lot of my autistic kiddos, they toe walk and it's sensory. They just don't like how it feels on their heels, or it's just that's just what they do. They go up on their toes. So we
Yeah.
just try to stop them, give them that sensory input in there. Um, yeah.
Yeah. Nice. Speaking of children with autism, do you have to go in with a different approach versus, somebody without autism? Kind of to talk about how that works.
I would definitely say yes. I do go in with a different approach. That's literally something I look for when I get an eval. I see what they're coming here for, and then I always go to see what the doctor's diagnoses are because it's usually there. And so then that I kind of rearrange how I do things because I also don't know like what level of autism they have. So if they have like low level, high level, like low functioning, high functioning, I really don't know.
Mhm.
So I just I always go in with the mindset that they're more low functioning, and then like when I go out there and when I first say hello to them or just see them, then I'm like, okay, then I can like adjust it to as is. Because if they're more higher level autism, like low level functioning, then it's more me like just putting their body in the position I want and a lot of demonstrating. Um, so then I have to be prepared. I have to be in a certain mindset to be able to do that and be prepared. And then it's also a lot of like educating to the parents at that point. Whereas if it's like low level autism or high functioning, then for them it's just basically like a neurotypical kiddo. I'll just say, okay, let's go do this, let's go do that. I can like make an obstacle course or not. So yeah, I would say it definitely depends like
Yeah.
on the level, but yeah,
Yeah.
it just always depends on the level.
Um, so you keep mentioning neurotypical. Do you see a lot, or not neurotypical, just like neuro in general?
Mhm.
Are most of the kiddos you see, having neurologic impairments, or do you see any orthopedic impairments at all?
I'd say I have a good mix. I do have some with neurological impairments, like ICP kids, which I really enjoy working with that population. And again, the
Great.
levels are crazy of what can be affected. Um, I have one kiddo who literally it's just his foot. He almost looks like a toe walker, but he's not. I mean, technically, I guess he would be considered a toe walker, but it's because of his CP that he is, because he just has that spastic calf, so stuck in that plantar flexion. And then he is fully functioning everywhere else. So we're just working on that, a lot of stretching, a lot of strengthening of the legs. Um, I unfortunately don't have, not unfortunately. I like working with that population. That's why I say unfortunately, but I don't have any like quad CP or kids who are like cannot walk.
Mhm.
But whenever I get to see another therapist kiddos for them that are impaired, like they can't walk, can't really use their arms, I really enjoy working with that population. Um, and that's just a lot of positioning, like what you would think a neurotherapist would do, a lot of positioning, a lot of holding that positioning, stretching, and yeah, just strengthening like what muscle they have if it just be their one arm type of
Right.
thing.
Nice.
Yeah.
So you talked about a course that you took. Besides PT school, are there any additional courses that someone would need to take to be able to be a pediatric therapist?
Um, Honestly, I would, because I had only done my clinical and then PT school,
Mhm.
and then, like the short class that we had in peds class, that's all that I went into pediatrics with. But you should be prepared to learn if you want to go into pediatrics because every day I'm learning something new. Um, and when I am at the clinic that I was at, I had training there, like on-site training from like for orthotics and prosthetics, which I absolutely hated that class so much.
Oh, that class,
I can't
girl.
believe, yeah, I hated it. And I just can't believe how much I have to deal with orthotics. And it's kind of sickening
Actually,
sometimes
so funny.
because now I'm like, well, now I know what this is, but I still don't like, I just remember hating that class so much. And then when I got there, they're like, okay, so you're gonna do orthotic training with so and so. I was like, wow, this, but but now I I love it. I'm not, not the hugest fan. I would never go into that, but
Yeah,
I'm so grateful to what orthotics can do for
yeah.
my kiddos now. And so now I know how to like fit my kids for them, how to like request them, like observe them and see which ones would work best, which I just remember in PT school, I was like, what is going on? I can't even tell you like any of these, like the AFOs, the SMOs. I'm like, I don't know, but now I know.
Yeah.
So yeah, so I got on-site training in that. I got on-site training for torticollis babies, like to do the eval, to learn techniques on how to treat them. And then we have something called MedBridge, which I think a lot of people use.
I
Yeah.
love it.
Yeah, me too. And they have all kinds of videos and mini courses that you can take. And my first like 3 months there, we did a ramp up schedule. And so I would see like sometimes 3 kids in a day. So I would just be watching like MedBridge videos, like, oh, how do I treat this? Like, what's the best approach to this? And then yeah, you just, you learn whenever you can. I'm taking Con Ed courses, just anything that piques my interest, especially but if it deals with pediatrics, I'm like, okay, I'm just going to do it because I know it's going to help me in the long run here. So I wouldn't say you need like any special certifications or anything, but just know that when you do peds, you should be open to learning, which I feel like that's with any setting that you go into. You should be open to just learning new things
Yeah.
and learning from the other therapists. They have there's 2 therapists there that have been there for like 15, 16 years. And so I go to them for everything. I'm like, hey, I have this kiddo, and it's just so
Right.
easy to like brainstorm with them, and they'll be like,
Yeah.
oh, have you tried this? I'm like, I haven't, but thank you. So
Thank you for that.
it's
I needed it.
yeah, it's really important to like be humble and be able to go and like ask them and be like, hey, I'm out of my depth here. I have no idea what to do.
Yeah.
So it's so important to be able to do that because they've helped me so much with my kids and just because I want to provide the best care for my kids. So I need to,
Yes, of course.
yeah.
Do you think so? Let's say there's a new grad and they have not, for whatever reason, they haven't done any rotations in pediatrics, or you have a therapist who's an adult, who usually typically works with adults, excuse me. Do you think that they could just jump into pediatric therapy? Why or why not?
I want to say I think it depends on the person. I right now I have a coworker and she's been a PT for longer than I've been alive, like 45 years. And but she recently switched, I think she said 5 years ago to peds. And before that, she was just doing adult ortho. And she just reached out to them and she said, hey, I've been a PT for this amount of years, but I want to just try working with kids. And they're like, you're hired. Um, and so, but she does amazing. And I think it's because she loves working with children in general. So she like has a passion for the kids and she works really well with kids. So for her, I think she did say it was challenging to like switch her brain to like rewire her brain to working with adults to kids.
Mhm.
Um, but I mean, she loves it and she's an amazing therapist. I go to her for a lot as well. Um, and then as a new grad, I would say, yeah, you can definitely do it. But I think, and even for an adult, if you want to switch, I feel as if they should observe
Mhm.
and just see what it's like and what type of kids you're going to be working with day in and day out. Because I've also had some coworkers who they came from adults and they went into peds and then they left because it just wasn't what they thought it was. And so I would definitely say I think they can do it. I think
Mhm.
it depends on the person. And then also just I think you should observe or just do more research into it to see what it is, like if they think that they can do that long term.
Yeah, yeah. Is there anything that you feel like a ped, like there has to be some inherent quality about a peds therapist. This person, they have to be patient or they have to be fun, they have to be creative. Is there something that someone should kind of inherently have that would draw them closer to being a peds therapist?
I don't want to limit anyone to like if they're thinking about it, I don't want to limit anyone, but I would definitely say patience is a really big one. Um, and just I think you have to have a passion for kids, honestly. Like it doesn't really matter what your personality is like, but I mean it does to a point. Like for any job, it does to a point. But I think having a passion for them and yeah, patience, having a passion for them. I do think being creative would help a lot just because you have to be engaging. You have to try to get these kids to buy into you, and that's
Right.
different than how you do with adults. I would definitely say you have to be very kind of chill. Go with not very, but I mean, pediatrics is so unpredictable.
Yeah.
Like you'll have one kid one week and it's the same exact kid and he'll do so amazing, does so great, and then the next week he's a monster or she's a monster and you do not know what to do. But it's the same kid. So you
Yeah.
and I'll have a game plan going in, and then if I see how they're acting, I'm like, oh, okay, we're switching it up entirely. Like we're
Right. You're on
sometimes
that kind of mood.
yeah, sometimes my session is literally just trampoline, swing, trampoline, maybe a step, like going up and down the stairs one time,
Yeah.
and then trampoline and swing. Sometimes that's all I get done, and it's just because that kid is having a day, and you just have to go with it. You still have to see them. You can't send them back and say, no, I can't see them today because they're not cooperating. You just still have to see them.
And like you said, the trampoline is great because it's those gross motor skills where they're getting the strengthening from jumping, or they're getting that input, and it's still
Mhm.
balance as well. Um, it's
Exactly.
endurance. So you can still
Yeah,
it's set, guys.
exactly.
These things we have to be, like I said, I'm not the most creative person, but if you're going to do an intervention, think about the different ways that you can bill for it, right? Like,
And that's
um,
exactly what it is. That's
yep,
exactly what it is. I have to justify it.
mm,
So, and I will justify about
yep.
anything. Don't worry.
Yep,
But yeah.
exactly. Kind of going back to your kiddos with autism, we actually had an individual with autism at our facility. And earlier you mentioned that you worked with children like 4 weeks to, you said 22 years old, was it? Yeah, so I thought that that was really interesting. Obviously, I learned this in school, but I don't think the listeners know that in PEDS world, it's not 18 and you're an adult, right? What age does it typically go to 22 then?
I think most pediatric places go to 22. Um, I can't tell you why,
Yeah.
but I think that's most pediatric places. And
Yeah.
then a lot of the times, like the 17 to 22-year-olds that I see, they are um neurologically impaired, so a little mentally delayed.
Mm-hmm.
Um, so they do not act like a typical 19 to 20-year-old. They act like a 4-year-old or a
Right.
3-year-old. So
Yeah.
that's why
Mm-hmm.
we take them because
Yeah.
yeah.
No, so this individual that went to our facility, he was, technically, like age-wise, technically an adult. But since he had autism, falls under still P's as under 20,
Yeah.
right? And so he was so fun to work with. He was a lot sometimes,
Yeah.
but the thing about this, he wasn't I wasn't primary on him. I just got to work with him or see him in the gym intermittently. There was like three songs that he would always play. And one of them was Holly Jolly Christmas. And like I feel as though I am scarred now. So when Christmas comes around, I will not be able to
Ugh.
listen to that song. Just because we're like, oh, buddy, is there any other song you want to play?
Right.
Or like
He's
he would just
something.
keep requesting that same one, or he'd have like, two, he had a rotation of three songs that he really played, and then there were some other ones, but um Yeah, and I'd be like working with my patient, over in a different part of the gym, and he'd be working with the other primary therapist. And my patients would be like, I can't listen to this song anymore. And I'm like,
Gotta turn it off.
I'm sorry, there's nothing I can do.
Right. I
Oh,
love
man.
that.
No, but besides him, I actually haven't worked with very many individuals with autism. I think honestly, like I think he was like my first or maybe my second. So I think it's cool that you get to work with them frequently,
Yeah,
um just different populations, even though I also am a neurologic therapist. I don't see certain conditions that you get to see, right? Like
right.
I don't really see autism. You mentioned cerebral palsy. That's not one. I have worked with a few individuals, maybe two or three, but that's another diagnosis that I'm not as familiar with. So I think it's cool that we still are both in the neuro world, but
Yeah.
seeing different patients, age wise, but also diagnosis wise. So
Right. I
very
know. I tell
great.
everyone PT is so cool because you can literally pick anything and like relate it to PT and be like, oh yeah, you can be a PT for that. It's so
Yeah.
cool. I love it. It's just amazing.
I know. I was like, I feel like we will have a job for a very, very long time.
Yeah,
If you ever, don't like your particular niche, you can just pivot to something else. You don't have to get
absolutely.
a whole new degree, go back to, no, just pivot, maybe take a few courses in that subject,
Right.
or that, that other niche that you're moving to. But it's just nice to like bounce
It,
around if you need to.
yeah, I love it. I'm
Yeah.
obs- Real quick, you mentioned music, and I just want to say how crazy music is because it's such a great tool as well that we use.
Yeah.
Um, And like a lot of my kids, I'll have on music in the background. One of my coworkers, she's in OT and she did a continuing ed course about just like music therapy. And there's this certain app and it's called like Quick Fix or something.
Mhm.
And they have different songs and for different things. And I bought one of the songs and it's for regulation and movement encouragement. And so for some of my kids, if I just see that they're having like a hard time just regulating and they just need all the input, I'll put that song on and like on my phone just really loud. And it's crazy how I can literally see them just start to relax. And then while they're listening to this, I let them do whatever they want.
Yeah.
And they'll like be playing with something, or sometimes they'll just like be sitting there like just staring off into space, but listening to this music and you can just see them relax. And then after the song is like 16 minutes long. It's super long, but I fell for it.
Yeah.
So we're done. I'll say, okay, let's go do some work. And they'll get up and we'll go do some work after listening to it. So music is crazy and it's such a great tool.
Yeah.
Really, yeah.
What do
It's
you
awesome.
mean by sensory dysregulation? What does that look like in a kiddo who's going through that?
It depends on the kid. Uh, Today actually I had a kid and he just kept on throwing himself at me, like just trying to knock into me and like rubbing his head on my legs. And so I just give him input, like squeezes his head. We were on the trampoline and he just wanted to be bounced. So I was just jumping and he was just laying on there and just being jumped or bounced, however you want to say it. And he was just seeking input, like some type of sensory input. And a lot of the times it's like that tactile sense that they want, like that those deep pressures. And so yeah. And I think it just depends on the kid. I have one kid who likes to spin, and so their sensory input that they need is being on the swing, and I'm just spinning them, which I can't look at them because I get dizzy. But they're literally just sitting there like being spinned and they absolutely love it. And then they are no longer like crying or upset because they just need that extra input.
So, I guess how would a parent know that they need to go to a pediatric therapist? What are some of the side? I guess it's going to depend on, what the
Yeah.
I heard it as soon as I said the question. But like, so I mean, you talked about the toe walkers. Obviously, you said the sooner the better.
Mhm.
Um, but for your kiddos who are 12 and 13, who obviously didn't know, how would their parents have known to go to you? Is that something you have to go to like a pediatric doctor first and then to you, or how does that work?
So we need referrals to see any kids, like our specific clinic. So we're usually getting referrals from doctors. And but for those toe walkers, whenever I ask them like, oh, how come it took so long for you to come in here? They'll say, I didn't even notice until like someone at school pointed it out, or I didn't even realize until I saw them interact with other kids. And a lot of the times parents will realize that something is not typical when they see their kids interact in a group of other kids. Or a lot of the times I'll have I evaled someone like 2 weeks ago and I asked them, what are your concerns? And she said, I don't really have any concerns, but their teacher mentioned this and suggested that we come see a physical therapist. So
Mm,
then I noticed some things that they could be working on that they have deficits in. So I told mom that. She said, oh, I didn't even realize that. So just I feel like because these parents see them all the time, like when I see myself, I feel like I don't change because I see myself every day. But then if I see someone who hasn't seen me in a while, they're like, "Oh my gosh, you've changed like this way or that way or whatever." And I think it's the same with parents and their kids sometimes. Like they don't even notice until they either see them compared to other kids or someone points it out to them.
interesting. So basically, socialize your kids, socialize.
Yeah, no, absolutely, absolutely. You sure? But a lot of the times our referrals come from doctors and the doctors see something, or sometimes the parents do have specific concerns and they request a referral to physical therapy.
Yeah. So in the case of, let's go back to, you said you work with a lot of kiddos with torticollis. Um, is that something that the doctor would see first? Is that something that parents usually start to pick up on? How would they know? Because you said the
Um,
earlier the better for that one as well.
yeah, definitely, most definitely. Uh, I think it depends how severe the torticollis is or if they have that flat spot, because parents will notice like the flat spot on their head and then they will prompt getting they don't even know why the flat spot is there. So they'll take them to the doctor and they're like, oh, it's torticollis. Let's take them to PT. So again, it depends, or sometimes the doctor will check the baby's range of motion. And if it's limited one way or the other, then they'll send them. And then the parents were like, I didn't even know, but the babies didn't have a flat spot. Or sometimes babies literally are like stuck like this. And so the parents were like, they can't move their head. They're always like this. Yeah. So if it's sort of called the doctors are sending it in, or parents see a flat spot on their head and they say, we got to get them in.
Yeah. Alrighty. Moving on. So let's talk about what are some of the most challenging things about being a pediatric therapist?
I would say right now for me is insurance. Dealing with insurances, they're crazy.
Yeah.
They're I don't know why they're so difficult to work with, but that for me is quite challenging having to just justify services that I feel like I shouldn't have to justify. I do, but writing letters of medical necessity need, uh,
Girl.
trying to get approval for visits or just for orthotics, braces, walkers, wheelchairs. Um, I think that's challenging. I also think just seeing in my coworkers, um, burnout, trying to prevent burnout, because I'm sure it's the same with adults. But I just like you want to give the best care to every kid, and sometimes their stories, their backgrounds can be really sad. So taking on that emotional type of baggage and not like trying to just leave it at work, leave it with that specific kid when you move on to another kid. Um, I would say that's kind of challenging. And then also, I just have some kiddos that are just, I don't know what to do with them. So trying to find ways to be able to better help them is also challenging
Yeah.
in a fun way, but still sometimes challenging.
Yeah. So on the opposite side, what is like one of the best experiences you've had being a pediatric therapist?
I don't know if I can pinpoint a specific time, but it's kind of going back to working with like parents and families. I love when I have a relationship with the family and with the kid, and just to be able to discuss plan of care, but then also discuss like, oh, how was that trip? Or just having that connection with the families and the child, and being able to see what a difference you've made is
Mhm.
just so nice. Like whether it be like this family went to Disney World and they're like they were able to walk like basically the whole time. We only had to get a stroller like at the very like in the evening, when before like they wouldn't have been able to last that long or just be strong enough to like go up the steps and whatnot. So just even just like little things like that in like little day-to-day life, I'm like, oh, okay, I'm glad like we're making a difference. Or just being able to see the kid, like they couldn't jump, but now they can jump, and now they're in gymnastics, and now they're able to do these things that they weren't able to do before. So I just love being able to see like the little things like that, the little progresses, and yeah, just being able to connect with the kids and the families. I like that.
I feel like pediatric therapists, you guys have a unique relationship with the families. I think you guys get so close to them. Not to say that working with adults you can't, because I think that there's definitely spaces where you do, like inpatient rehab, for example.
Right.
But I think it's really cool that you guys also get to see people over like the course of their life. So obviously we are still technically new grads, 2 years out. Well, coming up on 2 years, which is so crazy to think
I know,
about.
I can't
Girl,
believe
I
it.
got the notification that my license needs to be renewed, and I was like,
Oh my
all
gosh, yeah.
right.
Oh my
Like,
God.
that
You're
was
like,
so
ew.
crazy. Yeah, no. I was like, I just got out of the residency. I'm not even fresh, but anyways.
No.
Yeah, so we're still, kind of new grads. So I don't know if you've gotten to experience this yet, but seeing somebody, because I imagine that for certain like developmental, like for example, cerebral palsy, CP, you're going to be seeing these individuals like every year, kind of for a block of time. They go home to work on the skills, and then they come back the following year, and you kind of work on, okay, these are the new skills that we need to work on, because you've grown in XYZ ways, you've gotten taller. We need to keep working on your strength and your balance. So anyway, why am I saying all this? I just think it's really cool that you get, like I said, you get to see somebody almost yearly, kind of see their progress, see
Right.
how they're developing. And I also feel like you guys get more updates on your patients versus us with adults. So adults are like, see ya. They're
Right.
like
Never heard
gone.
from him
Like
again.
they don't want to remember that event at all. Whereas I feel like because you guys get so close to parents, like they'll like still send you little here's a picture of little Johnny, on his first soccer game, and like it's all because of you guys. Like I still feel like that's just a really cool rapport that you get to build with the families, I feel
Yeah.
like. Yeah.
No, I agree. I love it. And yeah, being able to see like if we discharge, like especially the toddlers, like when we discharge and they're like, oh, they're like doing this now. I'm like, oh, I love that. Little babies. And sometimes you get a little, I feel like going back to gaining that rapport with the families. I had one parent text me if I wanted to go work out. And I was like, wait, no, we're not there. I'm sorry. I can't. Called me at like 10 p.m. I was like, no, we're
No,
not there. I'm
no,
sorry.
no, no,
So
no.
I think sometimes I'm like, okay, we have to reel it back a little
Grace.
bit. But yeah, but I do I'm happy that I have that connection with them, and like that they think that they can do that, if that makes sense.
Yeah.
Without, yeah.
Yeah, I get what you're saying. I can accept it, but thank you for thinking of me.
Right, exactly, exactly. I'm like, oh, thanks. But
Like, don't do it
right.
again. Okay, so you mentioned some of your favorite interventions. Let's kind of get back to that. You mentioned like obstacle courses, you mentioned the trampoline. I guess walk us through. So this child has spastic cerebral palsy, right? Which you can tell us what that means, but they have spastic cerebral palsy, and you want to work on this individual's strength and their balance, and just getting them to an overall higher level of play.
Mhm.
They are, I don't know, 3 years old, 3 or 4, and they are not able to crawl really or stand. Kind of
Mhm.
walk us through your obstacle course. Like, what would you do for them? Or what, not
Yeah.
only the obstacle course, but intervention. Kind of what
Yeah.
would you do for this kiddo?
Right. So for them, if they're 3 and they can't stand, they can't really walk, then we have a baby area.
Mhm.
And it's a really cool baby area. But so we have a baby area. It's basically just a zone for the kiddos that aren't walking yet, but I call it the baby area. So I would probably take them there, and we have mirrors and we have benches and we have like foam ramps and like little foam steps. So I would definitely take them in there, and we have all kinds of toys in there. We have the little squigs that stick on the mirror and they spin. I mean, kids love those, they eat them up. Um, sorry, I'm explaining like
No,
everything.
it's gonna be like they eat them up.
Right.
The kids belong, okay?
Yeah. So we would be in there, and I would say we would just work on positioning, like facilitation, being in tall kneeling, half kneeling, being in that quad position, just trying to strengthen our proximal muscles, like our core muscles, our upper extremities, are just trying to strengthen those because I'm sure you know we like to strengthen proximal to distal. So just working, yeah, just working on those specific positionings. And then even seeing like if she can stand with assist, like if I'm holding on to their pelvis or even at their knees, and if their hands are up on the bench or up on the mirror, just seeing what they can do and kind of pushing them to that limit type of thing.
Nice. And
Yeah.
what on the spot for that question?
I know. I was like, oh my
You're like, wow.
God. I'm like, it depends on the
Right
child.
now. I was trying to get specific.
Right.
No, it's so funny. So Dr. Kennedy, looking back on your journey, is there anything you would have told yourself, like any advice that you would give yourself, your former self, excuse me, before starting this road?
Um, I would say not to be afraid to try new things with like patients or to, well, we'll take it back to like PT school to definitely have paid more attention in the orthotics and prosthetics class because wow, I literally go back and look at my notes and
Yeah.
wait, what is this one? What is this one for? Like, what are the indications? What's it gonna do? So yeah, definitely pay more attention in that class. And then, but yeah, not to be afraid to try new things. I would say definitely just affirm my not being afraid to ask questions and like not being afraid of looking dumb and stupid, but just going and asking the questions that I have. Um, but yeah, that's about it. I would say. I feel like my clinical rotation and our short peds class really prepared me like to be entry level for sure. And then now it's just
It's,
continuing to learn by experience, but also by taking those courses, but mainly by experience and trial and error on ways to treat the kids.
yeah, awesome. Any advice for people looking to pursue getting into peach therapy?
I said it before, but I would definitely say do observation, make sure that that's something that you want to do because peds is not it's not a little bit of work. It's it's a lot of work. You have to I love it because you get a little bit of ortho, a little bit of neuro, like you get a little bit of everything, I would say. So, yeah, just do your observation, make sure that's something that you want to do because yeah, it's not just you're not just dealing with adults. You have to be able to relate to the kids. You have to be able to switch up because you're going to have a 2-year-old and then you're going to have a 13-year-old. So like just the way you interact with them, the way you talk to them, everything's going to switch up. So you just, yeah, I would say observation, observation, do your research so you know what you're getting into.
Hello. How do you do with since you just mentioned it, how do you do with switching up like between working with babies to then teenagers, then to, your preteens, 8-year-olds, all that? How do you bounce back and forth?
I kind of love it, honestly, because after I have a 3-year-old that's not listening to me, that I'm just corralling around the gym, and then when I have a 13-year-old that I can actually have a conversation with, I'm like, oh, this is a nice little break. This is a nice break in my day.
Yeah.
So I don't know, I like it. And
Yeah.
my schedule, usually I have my set schedule with my set kids. So I sometimes I'll have some flex or one times in there, but most of the time it's my own kids that I know already. So it's easy to anticipate how I'm going to interact with them because I already know them. So I'd say that helps a lot. When I first started out, I didn't know when I was seeing them for the first or two, second or third times. I struggled because I just didn't know how they were, how
Right.
I should be with them. But now I'm
Wow.
I
I was gonna ask, like, yeah, how do you keep current with the kids? I mean, not just, we're not old by any means, but like, I mean, I don't know what they're watching out there, or like
right.
who their idols are. Like, how do
Mhm.
you kind of be able to be relatable to your patients?
Right. I literally went to the theater to see these kids movies. I'm going on Monday to go see Inside Out too.
Well,
Like
that Fox part is good.
I know, me too. I put on episodes of Bluey so I knew who the heck they were talking about. I did my research on Paw Patrol because that's what the kids are into. I can name you a lot
Yeah.
of them. So yeah, just whenever I hear them talk about something, I'll be like, what is that? And then I literally go home that night and I'll look up Paw Patrol characters and just, because I have to stay relevant. Like you said, I have
Right.
to stay hip with these little children.
Like I mean, I know Paw Patrol, but I was like Bluey, that one sneaks past me.
Yeah. Yeah, exactly. I was like, what is that? It's funny, and now they have me saying nar. It's
Great.
That's just fun. I love peds. You get to just be a huge kid, and
Yeah,
all day I'm just being goofy with them.
that
And
does sound fun.
yeah.
I'm a bubbly person. I wouldn't say I'm goofy. Um, I don't know. So, but like I said, everybody has their niche, and I'm
Yeah.
that you found yours. I'm gonna stick with adults over here, but
Right.
oh, well, I definitely appreciate this conversation. I think it's been great. Kennedy, anything else? I'm sorry, Dr. Kennedy. Let me put some respect on your name, okay? Dr. Kennedy, PT, DPT. Anything else that you want to give to our listeners? Any little tidbits, any final words that you have to share?
Um, I guess I can share if you're looking into going into PT school or just PT as a career, I would say do it. It's amazing. Like we said, you can do so much with it and you make such a huge difference in people's lives, like no matter what setting you go into. If you're thinking about pediatric PT, I would say do it. It's so amazing. It's so fun. Do your observation though.
Yeah.
Um, if you have kids that you think could benefit from PT, it doesn't hurt to get an eval or just a screen, honestly. I think most places, like if you were to say, hey, does your clinic do screening? Like they might, and it wouldn't hurt to just get a screen just to see what's going on if you have any concerns.
Yeah, that's
Yeah,
awesome. Thank you for that.
of course.
Perfect. Well, guys, this has been, like I said, a great conversation on pediatric therapy. It's been so cool to have another doctor on the platform. We're just chatting it up. Girl, I still can't believe we're doctors, but
I know.
anyway. Oh my goodness. It's been great catching up with you too. Like I said earlier in the episode, Kennedy and I actually went to school together, grad school in PT, or for PT, excuse me. And yeah, we were, little girl gang. We have a group of girls that we would all hang out with and help study together, all that kind of jazz. So I'm wishing Kennedy the best, of course, especially since she's in my home state. She has now been converted to be a Buckeye. Right, Kennedy? Right? Right?
a lot of that. No.
Her heart, she is. She doesn't want to say it on this platform because she'll get in trouble. But all right, guys. Like I said earlier, go follow this page on Instagram, YouTube, TikTok, all the good platforms at BPBB Podcast. This episode will be available on Apple Podcasts and Spotify. The video will be available on YouTube. This was a great conversation with Dr. Kennedi, PT, DPT, who is a PEDS therapist. And I'm your hostess, Dr. Hannah P. And we're out. Bye.